I'm Michelle DeRamus, a child psychologist with Preferred Medical Group, and I practice at our Phoenix City Children's location. I work with children doing therapy and testing for a variety of problems, including anxiety, depression, ADHD, and autism, among other things. Today I'm going to be talking about how to foster independence with your children while also teaching them to be respectful of adults. So it's really important to make sure that your child learns how to be independent. This encourages free thinking and creativity. So we want to start at a young age, making sure that we're fostering that independence in our children. A few tips for encouraging independence include giving your child choices as often as possible. Sometimes that might mean that you have a couple of choices to offer them, like, do you want to take a bath before dinner or after dinner? Or do you want to wear your blue socks or your green socks? But you're still giving them a choice and an opportunity to feel like they're being independent. We also want to encourage your children to make some choices, even if it's not the choices that you would choose. And that might be choosing their own outfit, even if it doesn't quite match the way that you would like for them to. Or doing their own hair, maybe even if it's a little bit messier than you would have chosen for it to be. Another good way to foster independence is to make sure that you really hear your children and listen to them. So if they ask you a question, maybe ask them what they have to say about it or what they think about it before you give them an answer. So while we're encouraging that independence, we still want to make sure that children are being respectful when they're letting you know that they want to have their own turn. So one of the things that we can do is encourage children to ask politely to have a turn, or to ask politely to do it themselves. So instead of "no, me" and grabbing, we want to encourage children to say, "Mommy, can I do that, please?" So that's something that you can begin working, even with very young children, on how to ask in a more polite way, or to put out their hand to request something instead of grabbing. That's a much more polite way to do it and to begin to show respect for adults. We also can teach polite ways to interrupt. Young children especially really need their parents' attention pretty quickly, but even at a young age we can teach children to say, "excuse me," or if they ask for something, if they're interrupting an adult conversation, you can say, "Wait, let mommy finish this sentence, and then I'll answer your question." And then as they get older, you can begin encouraging children to wait until the conversation is over and teaching them polite ways to interrupt, such as saying "excuse me" or "I need your help" or something like that, instead of just interrupting. We also want to make sure that we're rewarding those polite behaviors. So if your child does ask politely for a turn or to do something by themselves, go ahead and try to let them do it if you can, because if you reward that by letting them have that independence, they're more likely to ask for that independence in a polite way the next time around, because they see that it works. We also want to teach children to compromise. That's a nice way to show respectful behavior. So you can offer your child alternatives. So for example, if you're in a hurry and trying to get to the car and your child wants to get dressed by themselves, you can say, "Mommy really needs to do it this time because we're in a hurry, but you can take your hairbrush with you and brush your own hair in the car." So offering a nice way to compromise models that for your children as well. So I hope that these tips will help you encourage independence in your children and also help them learn how to be respectful of adults and other children around them as well. For more information, please visit our website at www.preferredmedgroup.com, and that will give you information about our practice and also about our child psychology services.